Dr. Harris, there's so many questions about this mysterious illness. If you could perhaps tell us what we actually do know at this point about how it's transmitted.
Well, indeed, I'm very glad that you invited me to explain, because actually it's probably not one illness. We've actually seen 3 clusters of cases of illness, and the first one you mentioned happened in one area called Bolomba, and more recently we've seen a different cluster in another area called Basankusu. Now, both are up in the northwest of DR Congo in an area called Equateur. But we think that, and we have indeed listed 1,000 cases, but that is actually because we've made the definition of the case very broad. We've basically just looked at anybody with a fever. So it's highly likely that we've got a number of different diseases, but we are concerned about the cases in Bolomba that were reported in January among young men, because 8 of the 12 cases died. And we want to understand what it was that killed them. Now, you mentioned that 3 children found a bat and ate that and killed it, and that killed the children. We're not sure that that was actually an infection or a poison, and we're still doing the testing to understand. So while there's a lot of panic out there, we actually think it's probably a number of different things that are going on.
And one of those things that could be going on is people eating bats?
Well, eating bats is a thing that does happen in quite a lot of countries. The bats are a delicacy. We always recommend not to eat any animals that you find dead in the forest, because whatever killed the animal could kill you. But it happens. But this is really probably not the thing that's causing these other illnesses. We're looking at possibly a poisoning in one of the clusters. We're looking at potentially, could it be malaria? We're also looking at whether it's meningitis, which sweeps through populations and is one of the few infectious diseases likely to kill young adults. The unusual feature in the first cluster particularly was that we saw a lot of young adults affected and who died. And that's unusual. Usually young adults die from violence, not from infectious disease.
And Dr. Harris, I just want to make sure I understand this. So these different clusters at this point, they may not necessarily be connected, right?
That's right.
Okay.
That's right.
Okay.
Even though it's in Equateur, in a province, the infrastructure is so poor, it's so hard to get around there that, you know, they may as well be in Samoa and Switzerland. That's so we don't think that they're necessarily connected, yes.
So what about the fact that some of the samples that were sent to Kinshasa tested positive for malaria? Is that true, and what does that tell us?
Well, in fact, the samples that were taken, a number of people were tested for malaria using something called rapid diagnostic testing, which is a screening test for malaria, and 50% of them came back positive. Now, that just means a lot of people had malaria, but that's exactly what you'd expect in that population. And while malaria is a killer, it's usually a killer of, sadly, of children under 5. So again, the deaths we're seeing don't really fit with malaria, but malaria could be a contributor.
So what do you tell people who are very concerned and live in this hard-hit region? How are they supposed to protect themselves right now?
So indeed, we've sent up teams, rapid response teams and national teams from DR Congo, and we've sent some experts with them to do exactly that, to give people the advice, but also the medical support, and particularly improve the treatment, increase the treatment for malaria, but also for meningitis, and to look at whether, again, there has been a poisoning event. And to really strengthen the health systems, but also give the people advice about what they can do to protect themselves. So that's exactly what we're doing right now.
All right, we certainly appreciate you coming on and shedding some light on this very important story, Dr. Margaret Harris from the World Health Organization. Thank you.